I'm an occupational therapist and I care. As corny as it sounds, it's true. In fact, as OTs, the healthcare system looks to us because of our special emphasis on healthcare delivery. In 1980, Carolyn Manville Baum talked about this and implores us as OTs that we have to get out there in the community because we're not always being seeked out by the patients. In addition, we need to build collaborations with scientists and other clinicians for research to expand our field. In order to really show our passion, we have to be at the heart of this movement, and that's what we do as OTs.
You know, you people before 1981 should really listen to your elders. We go back like maybe 200 years to the age of enlightenment. You can find occupational therapy being done. May not be called occupational therapy, but as times changed, we were always client-centered. We cared about our patients. You can see that today. The same fundamentals are still being used. So you can speed up and expedite your research if you look in the past to see what's already been done. Listen to your elders.
Hi Sherry, my name is Riley. I'm going to be your occupational therapist. So I see on your chart here that you suffer from motor vehicle accident. I was just wondering what kind of occupational therapy activities you would like to work on.
Well, I did a lot of work at home on my computer before the accident, so I'd really like to work on my computer skills.
I see. Well, in the past, with patients with motor vehicle accidents like yourself, we've worked on ADLs, which is like helping you get dressed, helping you brush your teeth. I know that's worked in the past, so I think that's what we're going to do with you. Here's a toothbrush. You can start trying to brush your teeth.
Okay.
So in my article, 1983, we occupational therapists didn't really, they tried to include clients into their activities, but then they would just focus on what they did in the past. So if those things correlated, they would stick with the interventions the client wanted to work on, but if not, they would just kind of go with what they had done in the past.
Who exactly are you again? What? Is it not obvious? I'm a construction worker. Wait, am I? No. I'm not a construction worker. I'm actually a personal trainer. Or am I? No. I'm Superman. That's my real profession. Or is it? I don't know. No. I know who I am. I'm an occupational therapist in 1984. Anyways, our profession during this time is having an identity crisis, and basically we're trying to figure out our proper place within the healthcare system. Eleanor Guilfoyle thinks that we should view this crisis as a positive instead of a negative, and to try and get away from that medical model and go into a model of helpfulness where our clients can, actually put their insight on their own healthcare plans. Basically, what we need to remember for this transformation of our profession right now are these three factors. We need to kind of slowly get away from that medical model. We need to attempt to slowly see this decline of patriarchy in our field, as well as we need to transform our views and our ideas of the profession so we can, place ourselves into a better area for the future. We need to not have the influence of other people outside of our profession, because then where's our integrity? So as I said, to be able to get through this transformation, we all need to stick together, remember those three factors, and we will take on this current change.
Hey Grandma.
Hey, how you doing?
I'm doing good. I'm just trying to study for my exam coming up. I'm trying to figure out the difference between monistic and pluralistic approach.
Oh, you need some help? I was a straight A student.
Yeah, sure. Sit down. You can help me.
Oh, let me get my typewriter.
Typewriter? Grandma, we don't use typewriters anymore. Haven't you times. Like, times are evolving and you're still stuck in the past.
What? I'm old?
Exactly. You're old. See, here it's like out with the old, in with the new. It's just like the monistic versus pluralistic approach. See, look. In the 1980s, establishing professional identity was a major concern. There were two approaches, monistic and pluralistic approaches to occupational therapy identity. Monistic is the belief that there is one principle. Pluralistic, on the other hand, is the belief that there are many different principles that go into identity. Over time, we strayed away from the monistic approach and evolved to a broader perspective, which is pluralistic. Grandma, you're a genius. I'm always going to remember that.
Oh, told you I was a straight A student.
I know.
Today, Riley is receiving treatment through a fun activity while we are playing catch with this Velcro set. It allows her to practice skills such as balance, hand-eye coordination, social skills, strength, and her range of motion. Although not all treatment can be this fun, it is essential that it is valuable to the client. That is what Claudia K. Allen discusses in her article, Activity, Occupational Therapy's Treatment Method in 1987. Those who are disabled already are limited to the type of activities they can successfully participate in. That is why it is so essential for OTs to really evaluate their clients' wants and needs, and then find activities that give their clients meaningful involvement within their lives, within their family life, and within their communities.
The 1980s, specifically 1988 and 1989, focused on three types of knowledge: philosophical, scientific, and technical. Technical knowledge is described to include both processes and products. Take, for example, in occupational therapy. Technology products include, but are not limited to, splints and other types of adaptive equipment. And the processes include group therapy, relaxation techniques, and self-care. In order for OT to provide the most effective treatments, all three areas of knowledge must be met. When OTs use their philosophical knowledge to entwine that knowledge with both methods to create a theory, occupational therapists will be able to use the most effective interventions. One of the most recent advancements is the use of neuroscience and the application of occupational therapy relaxation techniques such as biofeedback, deep breathing, and even yoga to increase immune functioning.
Hi, my name is Hannah, and I'm an occupational therapist. And this is my patient, Ashley, and she has leukemia. We're going to be doing yoga poses to increase her immune functioning. Are you ready, Ashley? I am. Ashley? All right. We have downward facing dog. Very nice. We have Halloween cat. And lastly, picking monkey. Wait, time out. My video messed up. I'm sorry. It's okay. It's hard.
Need a helper?
3.
Both ears?
Yes.
Okay. I'm ready. The theory. And I should do this for mine and then go down like this for yours. In the late 1980s, specifically 1988 and 89, it was focused on three types of knowledge: scientific,